From 10 till I was 14, I was like in a wheelchair, in a walker, in a cane, crawling on my hands and knees around my house.
It usually starts as pain or stiffness in your lower back. As many as 1 in 100 Canadians suffer from it, and it's 3 times more common in men than women. What is it? Ankylosing spondylitis, an inflammatory arthritis, which primarily affects the spine. I'm Sheila Walsh. Finding the Answers is a series that will introduce you to some remarkable patients and doctors from Toronto's University Health Network, which includes the hospitals of Princess Margaret, Toronto General, and Toronto Western. In the summer of 1997, Chris Vardy was a 10-year-old boy whose passion was playing sports. From hockey to lacrosse, there was nothing better. So imagine his reaction when the thing he loved doing the most was taken from him. In today's program, we'll find out what happened when Chris became one of those 1 in 100 Canadians.
Well, it was around 1997. I played for the Peterborough Lakers. That year we won the provincial championship, and I think I was about 10. I was just going into hockey season, and just got done like a little bit of physiotherapy, and I wasn't sure really what it was. All I knew is I had some pain in my ankles and some swollenness in my right baby toe, and I couldn't get my skate on, couldn't get my left skate on, and I couldn't get my right glove on, so we had to buy like 2 different pairs of skates and 2 different pairs of gloves because of the swollenness. So I wasn't really sure what it was. We went to my family doctor, and he said that my shoes weren't tied tight enough, and I need to tie my shoes tighter because it might be the rubbing against the back that was getting them swollen. So no one really had any clue what was going on at all. I couldn't play hockey. I had to cancel out on all the tournaments that I was registered to go in. And I got invited with another team to go to Kingston, and I wasn't able to do that, and that was disappointing. And I couldn't play a lot during the championship season of lacrosse that I went to play. I had to sit off just because running on the concrete floors was hard. And then after that I had to stop all sports. So I didn't really actually have a lot of friends when I was younger, just on my sports teams.
Chris wasn't only just dealing with saying goodbye to the sports he loved and his friends, but the mystery of what was causing his pain was still to be solved.
I was referred up to Sick Kids Hospital, and they did the testing up there, and that's when I found out I had the gene HLA-B27 positive.
HLA-B27 is a gene found in 8% of the general population. However, no more than 2% of people born with this gene will eventually get spondylitis. The gene itself does not cause spondylitis, but 90% of the people with ankylosing spondylitis have this gene. If a family member had spondylitis and you test positive for the HLA-B27 gene, your chance of getting the disease increases to 20%. It was over 30 years ago that a link between ankylosing spondylitis and this gene was first discovered.
I do have a gene of it, so I've had it my whole life. It's just the symptoms didn't start till I was 10. So I did have it my whole life, but just not the pain until about 10 years old. I was admitted to the hospital for 3 weeks where they did testing on me. I did games and activities, but just a lot of physiotherapy. Well, they tried to figure out what was wrong with me up there, and they couldn't figure out. They knew that I had arthritis. They were trying to figure out what was going to work. I did cortisone shots. Nothing really worked out too well while I was up there. Just nothing really helped at all. There's only a select few people that were there for me the whole way. that kind of helped me through. I missed a lot. I mixed my baseball tournament with the teachers for students, which I waited for like ever since kindergarten. I was sick, real sick that day, and I couldn't go, and that was really upsetting for me. So I missed out on a lot. I missed out on a lot of stuff. It was pretty brutal. They couldn't understand how like a 12-year-old kid had arthritis. Kids don't get arthritis, that's for old people.
In the fall of 1997, at the age of 11, Chris Vardy was diagnosed with the arthritis ankylosing spondylitis, a disease that would forever change his life. In the summer of 1997, when he was only 10 years old, Chris Vardy experienced the first painful symptoms of arthritis. It would be fall of 1997, though, before he would correctly be diagnosed with ankylosing spondylitis, a chronic arthritis that primarily affects the spine. It was hard enough dealing with people's disbelief over a child having arthritis, but giving up the sports he loved to play was by far the hardest blow.
I had to like stop hockey completely, so I couldn't get my skate on, and then I just couldn't walk. So like you're laying on your back in your room and you can't fall asleep because the pain is so bad in your hip, and you can't get up because it takes hip flexor strength, and you can't move, but you have this anxiety that comes over you that you need to move, and it's just impossible. So that was really hard. And then trying to go to school was really hard because the teachers didn't understand. They didn't want to help with anything. There's only a couple of teachers that were willing to help. I had my friend push me around in a walker, and we were at the Peterborough Farmers Market, and some old woman came up to me and asked me if that was for sale, if the walker was for sale, and if I was just playing on it. So there was a lot of stuff like that. People just didn't understand.
One person who did understand was rheumatologist Dr. Robert Inman, renowned expert in ankylosing spondylitis.
When he came in, he was a tall, lanky teenager that was walking with great difficulty. He had crutches and splints on his active joints, and he was chronically fatigued and walked with great difficulty because there were so many joints that were painful and stiff in his body. And seeing him come down the hall, your heart went out to him. Here's a young kid that really should be active and not plagued with this kind of disease. Chris suddenly found himself faced with living with multiple painful swollen joints, and it profoundly changed his lifestyle. He missed a great deal of school, and over the course of the next 4 or 5 years he was treated with a variety of medications, immunosuppressive agents, cortisone, splints, injections into multiple joints, but none of that really seemed to control his arthritis adequately. And so here was a young teenager who was used to being active in sports, faced with the prospect of being totally disabled. We had the fortune of Chris coming over to our clinic at a time when we were just introducing some of the new biologic agents for his type of arthritis.
Biologic agents, or biological response modifiers, are injected into the body under the skin, or in the case of infliximab, infused into veins by an IV. The biologic agents work with your immune system to block the protein tumor necrosis alpha, or TNF-alpha. It's thought that TNF-alpha starts a chain reaction in the body that causes swelling, pain, and damage in one's joints. When clamping onto TNF-alpha, the biologic agents stop the chain reaction, thereby decreasing pain and swelling in the joints. By blocking the TNF-alpha from working, this may control the ankylosing spondylitis, slow the progress of the disease, and stop permanent damage.